So this is big. Very soon we may indeed have a vitamin supplement to help treat and prevent glaucoma, which is a major cause of vision loss and blindness worldwide. So in today's video, we're going to be reviewing that of vitamin B3, specifically nicotinamide, and its effects at slowing down, preventing, and perhaps even treating vision loss from glaucoma. We'll include how it works, what the research is showing, and some potential side effects that you may want to know about if you ever choose to take a supplement like this. That's today's video. Let's take a look. First, what is vitamin B3? Vitamin B3 is niacin, also known as nicotinic acid, and your body regularly makes this by breaking down tryptophan, an amino acid that is often found in foods like poultry, fish, dairy products, and even some whole grains like oatmeal. You can also get niacin in its free form by eating foods like beans and liver, but either way, biochemically, your cells will turn niacin into what is called nicotinamide, and then further it'll turn it into nicotinamide adenine diphosphate, or NAD+, which plays a huge role within the cell's mitochondria for energy production and is finding in research to play a major role in metabolism, in aging, and even cell survival. Okay, so why is vitamin B3 then getting so much attention in terms of glaucoma? Now, if you recall from previous videos, glaucoma, in short, is a condition where the optic nerve in the back of the eye slowly dies over time, eventually leading to kind of a slow loss of someone's side vision, so slowly that most people don't know that it's happening until it's too late, where the vision starts to encroach on the center part of your vision, and unfortunately for people, it can cause permanent blindness where you can't see anything. It's just dark. Now, the problem with treatment for glaucoma is that most treatments, whether it be surgical, whether it be with lasers or with medication, is all focused on reducing the internal pressure within the eye. And that goal is really to help reduce the mechanical stress that the pressure can push on the nerve from the inner side and help prevent the nerve from slowly taking that damage. Now, what's cool about the vitamin B3 research is that they're showing that taking supplementation, specifically of nicotinamide, may be able to provide almost a metabolic support for the internal cells of the optic nerve and prevent that damage from occurring as well. I sort of think of it as an analogy of maybe a dam holding up a large body of water. If we had to try to save that dam from taking damage and collapsing, we can either reduce the amount of water that it's holding up, or we can add more cement, spackle, and give more structural support to that dam. Again, kind of like what we're doing here. We can reduce the pressure with medication, or we can add more structural support to the nerve on the other side. This really became an interest after a publication in Science in 2017 that looked at mice given nicotinamide supplementation and found that those mice had about a 93% reduction in the risk of developing glaucoma. And then in 2019, a small cohort of glaucoma patients were evaluated for any possible nutritional deficiencies, and they again found a pretty strong association between glaucoma development and nicotinamide deficiencies. However, I will comment on that 2019 study. It was a small cohort, and they did it through serum testing, which is a little bit controversial and may not be super accurate for measuring nicotinamide in the system. Now, that 2017 study with supplements was done on mice, but what about humans? Well, in 2020, they did a human study looking at patients already diagnosed and treated for glaucoma. What they did is had them split into two different groups. One was done with a placebo. The other was given 1.5 grams of nicotinamide supplement a day for 6 weeks. After the 6 weeks, they then upped the regimen to 3 grams a day. And then after those 12 weeks, they then went and did a crossover design where the placebo and treatment groups switched for that protocol. And what they found was that when given the supplement, those patients with glaucoma had improved retinal function on electroretinogram, and patients also had a slight improvement in their visual fields. which is the side vision test that we use to map out any side vision loss from patients who are suffering from things like glaucoma. And then in 2021, a similar study was published where, again, they took patients who had been treated for glaucoma, gave them the exact same amount of vitamin B3 from the previous study, but they also gave them a supplement of pyruvate, which is another molecule that has an essential role in cellular metabolism. But they found that the patients taking the supplement had a significant improvement in their visual field sensitivity, which is a way of sort of showing that if somebody had visual field loss, that around the edges of where they were testing was a lot more obvious and easier to test and map out that field loss, which leads researchers to believe that the supplement is indeed adding structural support to the optic nerve, especially the cells that may be already compromised from glaucoma. Of course, these studies were short-term, and again, the people in these trials were already diagnosed and being treated for glaucoma at the same time. So you may be wondering, is there any evidence that getting more vitamin B3 in your system could help prevent glaucoma? That's a good question, especially for anybody who may have glaucoma that runs in their family. Well, in a recent study just published here in August 2024, they looked at mice given both low doses and high doses of nicotinamide. The low dose was equivalent about 2 grams per day for a human equivalent, and the higher dose was closer to about 6 grams per day. But what they found is that for the mice that were given the supplements first, either the low dose or the high dose, that those mice had more protective effect against ocular hypertension or elevated eye pressure that came later. Where the mice that were given the elevated eye pressure and caused damage to their nerve first from glaucoma, that given the supplements later, only the high doses of nicotinamide offered any significant benefit, which could indicate that supplementation with vitamin B3 may have an even bigger, more important role in protecting the optic nerve before glaucoma or any elevated eye pressure ensues. But again, this was done in mice, and of course we do need more standardized human clinical trials before any doctors or the medical community at large is going to feel comfortable prescribing vitamin B3 or nicotinamide to either help treat already existing glaucoma or to help prevent it. But thankfully, there are some long-term randomized controlled trials that are underway in locations around the world, including Sweden, in the United Kingdom, Australia, and Singapore. And if you're watching this and you're thinking, hey, I would love to get involved in a clinical trial, I will put links to some of those trials in the description below so you can check it out. Now, I do think it's really important to talk about safety and potential side effects, right? Taking more of a good thing doesn't necessarily mean it's going to work better. And people who've had history of taking vitamin B3 supplementation have had reported adverse events, namely that of flushing of the skin and GI upset. And although rare, it has also been reported to lead to problems with low blood pressure, as well as insulin resistance, and even macular edema, which is a swelling of the retina in the back of the eye. And again, at high doses taken for long periods of time, it has also been linked to problems with liver function. Again, more rare, but it is a potential side effect, an adverse event, so good things to know about and talk with your doctor first before taking any supplementation. Just stepping back here and thinking about how vitamin B3 is supposed to help with glaucoma by improving mitochondrial function, it reminds me a lot of how red light therapy is supposed to help with eye diseases as well, which gets me really excited as we've talked about red light therapy briefly in some previous videos. And I hope to be reporting on some new information on that red light very soon. Now, before we wrap up, I do want to give a quick shout out to that of NanoDropper, which I think is an excellent option for anybody that takes medicated eye drops for glaucoma. The NanoDropper is an attachment that goes onto an eyedropper bottle and effectively reduces the size of the drop of medication. That way you can stretch out the medication and the bottle lasts a lot longer, reducing your cost, but also reduces any amounts of side effects that come from getting those eye drops hitting you in the eye and the eyelids. And it does this without any loss of efficacy of the medication. Whenever the topic of glaucoma comes up, I try to mention NanoDropper in some way because I think it is a really cool invention and I think it can help a lot of people. If you do want to look into it and go to their website, you can use Alan10 at checkout to save 10%. That is not an affiliate code that I won't receive any payment directly from you using that code. It's simply just a discount code because NanoDropper is awesome and is giving us that discount. But hey, if you found this video helpful, please do me a favor and hit that like button for me. And also check out my other videos on natural treatments for glaucoma coming up right here to the side. Thanks so much for watching. Dr. Allen here. Keep an eye on it, and we'll see you in that next video.